Welcome everyone. My name is Jordan. I am a first-year master's student in the OHP program. So you'll kind of catch me with the OHP click over there. So today I am going to be presenting on a research article that I found, and it's on how bird songs alleviate anxiety and paranoia in healthy participants. Okay, but first we're going to do an activity. What we're going to do is we're going to listen to two different kinds of sounds, and then we're just going to, by a show of hands, see which one you guys feel is more pleasing to you and more soothing. So we're just going to listen to each one for about 30 seconds, just see how you feel, and then we'll keep going. Okay. Okay, now we'll go to the next one. Okay, there's no right or wrong answers, but which of you felt more calm during the bird song? Yeah. And how many of you, by show of hands, feel the urban noise was a little bit more soothing? We got a lone wolf, Spencer, right there. Okay, awesome, sweet. Well, this is what we're going to be looking at more in depth from the researchers of this article. So let's talk about the background of the article. So the authors talk about how there is a increase in urbanization going on in the world, and by 2050, the figure of having the amount of people living in urbanized areas in the world is 68%. Without looking at the article, does anyone know what the percentage is of people living in urbanized areas in Europe today? 75%. Yeah, there's a lot of people living in urban areas. So, but why does that matter? It's because urbanization coincides with rising mental health illness rates. And the trigger is that urbanized areas kind of bring threat and ambiguity with stressful sounds, scenarios, situations, things like that. So the authors wanted to find ways that they could kind of alleviate those symptoms because of how many people are living in urbanized areas. Okay, so what they do is they look at sounds. And the first sound that they look at is urban noise, which is man-made sounds like traffic, sirens, construction, people walking, talking, things like that. These act as constant stressors, and they kind of start signaling to be alert and things like that. The next one is the biophone or nature sounds, which are wind, bird songs, trees rustling, water, pretty stream, whatever. And these are implicitly associated with kind of safe, vital, safe environments. And so the authors have two hypotheses. The first one is that birdsong soundscapes will have beneficial effect on mood paranoia. The second one is that birdsong soundscapes will have a beneficial effect on cognitive performance. So, okay, now I made this up just so that we can have a clear picture of how they perform their study. So they did a pre-post sound exposure test. It was a 2x2 within subjects design, and it was a randomized online experiment. So they got healthy participants online through like Prolific, things like that. and then they screened them to make sure that they didn't have any auditory issues so that they could actually hear the audio, and to make sure that they didn't have any pre-existing mental health disorders, which I thought was kind of interesting. So making sure that they didn't have clinical depression, anxiety, cognitive issues, anything like that. And then what they did was that they took a measurement of their anxiety, depression, paranoia, and cognitive scores, and then they randomly assigned them into 4 different groups. The first group is the low diversity traffic noise. So it just had a few recordings of cars, nothing special. And then the second group is a high diversity traffic noise. This has a lot more stuff like sirens, construction, cars, planes, a lot more diversity in that noise that this group listened to. The third one is the low diversity birdsong. So this audio only had 2 species of birds, the chiff-chaff and the wood warbler. It's awesome. So then the fourth one is a high diversity birdsong group, and this one had 8 species of birds. And so they then listened to this sound for 6 minutes each, for 6 minutes long, and then they retook those cognitive, paranoia, and anxiety and depression tests again to kind of just see the pre-post. One thing that they also did after listening to the sound for 6 minutes, each group rated their sound on a score of 0 to 100 based on beauty and pleasantness. So yeah, so they wanted to see like how pleasant was the low birdsong diversity group. So that's what they did. And now let's look at what they found. Okay, so we're just going to go one by one in each of the groups. And so with the first one, we'll look at paranoia. And this one is probably the most important finding. For the first time, the researchers saw that birdsong soundscapes significantly reduce state paranoia. Both, and you can kind of see both low and high diversity show decreases in these symptoms. And traffic noise showed no change. So kind of 1-0 for traffic, birds are up and down. So then next is the anxiety scores. Bird songs proved to be a good reducer for these anxiety scores. And again, traffic noise showed no change. So you can kind of see the different effects in the sounds with their scores. Next, let's look at their depression. Traffic noise increased depressive rates in high diversity traffic, and high diversity birdsong reduced depression. The effect sizes ranged from medium to small. And so I thought that was interesting, though, that we've kind of been seeing how traffic noise has not really changed any of the scores, but this is the first one that it actually has increased or worsened the depression scores through traffic noise. So the next one that they did was the cognitive performance, and they did this by testing the participants and their cognitive abilities using digit span and dual end-out tests. The result was interesting because it showed that neither the traffic noise or the birdsong showed any positive or negative effects. It was kind of a wash. And their explanation for it is that possibly the online testing limitations had something to do with it. So the lack of like controlling during their cognitive scores and the limited practice time that they had, things like that may have probably muddied the water on how valid those cognitive tests were. And so the takeaway to this cognitive performance result and the rest of the results is that birdsongs kind of acted as kind of an emotional regulator, but not as a cognitive booster in the short term. Okay, now I kind of also made this chart kind of to summarize kind of what we looked at with the effects. With the birdsong effect, we see that that it had a significant improvement with helping anxiety scores and paranoia scores and depression scores, but only if you were listening to high diversity birdsong. So if you're listening to low diversity birdsong, there was not a change in depression scores. And there was no effect in cognition. And then for traffic effect, for urban noise, there was no effect with anxiety scores, paranoia scores, a worsened condition for depression scores, and no change in cognitive scores. Okay. So, you guys remember me telling you about how at the end of listening to the sounds that they had to rate the pleasantness or the beauty on a scale of 0 to 100? Well, this is where we're going to talk about it now. So, they had them rate on a scale of 0 to 100 the beauty and pleasantness of the sounds that they listened to. But one thing that is interesting, though, is that both groups equally rated their sounds equally high. And so, but let's see how that affects how does that compare to what our brains perceive? Well, when we're looking at the depression scores, when listening to the low diversity audio, there was no effect in depression scores. However, those listening to a high diversity sound, there was a significant decrease in their depression scores. So the authors interpret this as evidence that subjective perception does not always align with biological or psychological outcomes, even if participants could not always consciously distinguish between the levels of birdsong diversity. Their mood, however, still responded differently. Okay, so the authors wanted to explain why. And then they looked at two different theories and then one other explanation. The first one is the stress reduction theory. And according to this view, nature environments contain cues that historically signal safety and survival. Sounds like birdsong may indicate the absence of threat, may promote feelings of safety, calmness, which can reduce physiological arousal and stress-related responses. The next one that they explained was the attention restoration theory. This theory suggests that nature stimuli are what's called softly fascinating, meaning they hold attention without demanding any effort. In contrast to urban noise, which can kind of grab your attention, make you feel startled, what have you. Birdsong may allow the brain's directed attention system to rest and not be on high alert. Then the third one is conditioning that they looked at. Over time, people may become biologically or socially conditioned to these sounds. So whereas you're kind of getting conditioned through the media or being out in nature that, hey, birds are actually associated with pleasant feelings, you're being conditioned to hear that sound and then automatically relax. Whereas with maybe urban noise, you hear a jackhammer in the background and you kind of feel stressed and you think that that's a possibility of being in danger when it's not, but you're being conditioned to feel that way. So that was their explanation as to why. Next, they looked at their limitations and considerations. The first one that they explained was doing an online experiment versus in a laboratory setting. One thing that's interesting is that there were other research studies done like this with auditory testing, and those were done in laboratory settings. But this one was done online, which I thought was an interesting choice, and I wanted to know the reason behind why. And they said that they had less control over participant environment, though they required and controlled the amount of decibels that the participants listened to the audio with. And then the next one is the sample bias, and they kind of found in their demographics that they had a lot of younger males, and so they kind of felt like maybe having a more balanced demographic would kind of shed a little bit more light on their results, and then they didn't have any neutral control. And so for future studies, it would probably be good to have a control where maybe they listen to nothing for 6 minutes, or maybe they listen to white noise, something like that, to have kind of a baseline or a control. And then the fourth one that they talked about was short-term exposure. Remember how they only listened to it for 6 minutes? Well, that doesn't really show the long-term effects of birdsong or the long-term effects of urban noise. And so a longitudinal study would probably help you capture that. So that was those were some of the limitations and considerations of the study. And so for future directions, I was wondering if you guys had picked this up, but the authors talked about including participants who do have clinical depression, who do have severe anxiety, who do have cognitive disabilities, things like that, to kind of start getting into the nitty gritty and actually seeing if that would help them or not. The next one is longitudinal exposure studies. I kind of explained that one in the previous slide, where they only listened to it for 6 minutes. It'd be good to have more longitudinal data to be able to see the long-term effects of birdsong and urban noise. The authors also discussed having more mixed, natural, real soundscapes, because I feel like sometimes if you're walking in the city, yeah, you'll hear urban noise, but there's a good chance where you'll also hear like wind or birds. So having a more realistic audio would be more beneficial for future studies. And then also for future directions, the authors explained having real world environments. So studying mixed, experiments in real world environments like clinical settings or everyday urban spaces could help translate these findings into practical, low threshold, inexpensive interventions. So why this matters is that urban planning, and with the increase in urbanization, it's good to start implementing and having maybe like civil engineers start implementing ways that we can increase the amount of exposure of nature into urbanized areas. And for workplace and occupational health, we spend a lot of time in buildings like we are now. The lack of being able to be outside, get fresh air, and feel calm, that they encourage to kind of have more implemented interventions for workers in the workplace where they don't have as much exposure to nature sounds. The next one is having the sounds be implemented in psychiatric or clinical settings. So maybe implementing these sounds in a waiting room at a doctor's office, so that, I feel nervous waiting in those settings, and maybe having some birdsong going in the background to kind of ease the tension would help as well. And then lastly, why this matters is that it's also a low cost intervention. So it's pretty easy and pretty easier on the wallet to implement these interventions, where we've seen that it does have positive effects in lessening these conditions. So yeah, okay. And then this discussion, these are just discussion questions that I had AI come up with. We don't need to get into the nitty gritty of all these. If you guys wanted to talk about any other things that came into your mind. But yeah, that is my presentation. So thank you for listening. Okay, we'll go you, Zach, and Spencer.
So the authors use the platform called Prolific to recruit their participants online. Has anybody used this before or familiar with it? So has anybody here used Amazon Mechanical Turk or heard of that one? All right, so Prolific kind of markets itself as like a research-specific online task platform, or online research-oriented online gig platform. And I've always find these a bit suspicious. So, I mean, looking on their website, depending on when this study was actually conducted, I don't recall the date off the top of my head, a huge amount of their marketing materials are based on AI detection and ensuring that you've got like participants who have real IDs associated with them. And so it's like, how successful are those tools, right? Is that even verifiable? Another line that really stuck out to me was quoting from their website, top performing participants earn priority access to studies and poor performers are excluded. So it's like, it's a platform that has a complete black box of selection bias. So I don't know. I just have a lot of skepticism about any of these kind of online platform recruitment strategies.
So they're developing professional participants.
Yeah. And this is actually super common in the marketing literature. And they use Amazon, at least a few years ago, they were using Amazon Mechanical Turk all the time. And so like that one, it was a particular platform that had not that great like filtering of quality participants and a lot of bots who were doing things. Point is just data validity here. I've got a lot of skepticism.
Yeah, that's a good thought. Like for RMPA, we had to throw our Qualtrics study into Prolific, and at 9 a.m. we submitted it into Prolific, and then by 5:00 p.m. that day, we had 500 participants that did our survey. And so it's a good thought to think about for sure. So yeah, Zach.
So this was awesome, and like first of all, because I feel like I didn't notice until now, but I feel like I've seen this intervention in practice. They at the Portland International Airport in some terminals and hallways, they have birdsong over like speakers. And I didn't realize that like maybe it could be because airports for some people are kind of it's a stressful place, and so maybe they're using something like this to try and bring nerves down.
Along with a lot of real trees in the new remodel, so that it's not just artificial sounds, it's actually real trees plus.
That's cool.
Yeah, cool. They've got a lot of wood and stuff and nature trying to into the Portland airport. But one of my questions was, did the authors, and if not, would you consider maybe controlling where the individuals grew up, was born and raised? Because like, let's say an individual born and raised in the Bronx, like they're probably super calm around that kind of stuff.
I think you're gonna steal Lucas's question because he said he was gonna ask you that. So I actually played this for my parents. My mom grew up on a farm, and my dad grew up in a tiny apartment in downtown Montreal in Canada, and he actually preferred the urban noise compared to the nature sounds, but my mom preferred the nature sound. And so, like you said, I think controlling for the participants would be really helpful for sure, but I think that would be something to think about in future discussions or future research for sure. Yeah.
That kind of ties into my question. I hate the sound of birds. I promise I don't know what it is. But I feel like I'm in a mental institution. I'm listening to it.
Yeah.
But my thought was, do you feel like, for example, like rain or waves or other nature sounds could have similar effects? And then I don't remember if they talked about it in the article or not, but the difference between like actually hearing those noises in real life versus a digitized like version of them, I guess. I don't know if they discussed that.
Yeah, I don't remember if they discussed that or not, but I think it would be pretty interesting to see how people react to actually maybe being on the beach and hearing it versus just hearing it on a recording. But what was that first part? You said you didn't
just like other like rain or waves or like wind or like more for me appealing than birds.
For sure. Yeah. Oh yeah, because they talked about in the article they talked about the biophone of nature sounds including water. So but for the sake of this study it was just birds. So but it would be cool to listen to that stuff. Yeah.
Yeah, I'm gonna back him up on this. Whenever I'm like looking for kind of like, the videos you played, like the like ASMR or whatever.
Yeah.
I like going into ones that kind of play with soundtrack music or kind of classical music over the top of like a light thunderstorm or like rain or something. And I like that more.
Yeah.
Just I don't know. It's that I agree with you. Like the weather sounds nice.
Well, and it's definitely something to think about for future studies and maybe seeing how people maybe respond to, like you said, having more like kind of music sounds compared to nature sounds. Because for me, my brain starts to I kind of catch myself listening to more of the music rather than what I'm actually working on. So I kind of like that white noise that kind of just drowns out possible noise and stuff like that. But that's just
Meanwhile,
me.
I listen to music with
Yeah.
lyrics while reading.
Yeah,
And that
for sure.
freaks people out sometimes.
Yeah. Yeah, everyone's different for sure. Yeah.
Comment, then a question.
Okay.
Back, the military was, back when they were drafting young men, they drafted them.
Point to me.
Well, no, I'm getting to you, but I'm looking at me. They had city boys and country boys all thrown together, and they found out that the city boys freaked out when they were put on bivouac out in the middle of nowhere when it was quiet. They couldn't handle the quiet. They felt afraid and vulnerable.
Yeah.
But the reason I looked at you, is it normal to ask healthy people about paranoia?
Yeah.
That surprised me.
Yeah. There's a whole lot of things on the methods once you dive into it that I have that question. And if you look at and that was one of the questions I was gonna ask, is you really want the baseline comparability to be the same across these groups, and what do people think about it, you know? And the first question is the CAPE scores. People looked at that, but those are not comparable across those data, I mean, at all. I mean, that's already a p-value of 0.058, so those are quite non-comparable. But then if you look at the other outcome indicators, unfortunately, they never produce a table of what those data are, which is a problem, right? Because but if you look at figure 1 and the lower left graph of the 3, because yeah, we definitely get the baseline. And that's very hard to see, but it sure looks like those are different.
So lots of work to be done and a lot of corrections to be made. Yeah.
I was going to ask you if you tried to find the paranoia scale. You know, frustratingly, they didn't cite which exact scale they used, but the one that I found that I thought they were using had all sorts of references to like social safety.
Yeah.
So in the context of an experiment, it's a little unusual because I'm guessing it's sort of paranoia light that they're assessing, like you're worried about something generally, but immediately I had a similar feeling about what was it they actually measured.
Yeah. I think I wrote it down somewhere, but I don't have it on me. I'd need to go check and I can let you know. So.
What about the duration of the experiment? Any thoughts on that?
About them just listening to it for like 6 minutes. Yeah. I definitely think that's something that I think they even acknowledge that, you know, we're not really looking at the long-term exposure of even like an hour. Like after a while, how are you responding to an hour's worth of birds, you know, or anything like that? And so I definitely think, are you really getting good data after just 6 minutes, which is something to consider. So.
Active for 6 minutes, but by 60 it might be irritating.
I'm going crazy here. Yeah, for sure.
Yeah, I guess first part, like, is it looping, like the sound of the birds?
I think it was a continuous sound. So I don't think it was
Like a
looping,
continuous
Yeah.
6-minute
Yeah.
recording. Okay.
but I would need to check again.
So I was gonna say, if it looped every 6 minutes over an hour, I'd be going.
Well, and I was thinking more about the urban traffic noise, like if it was on a loop and you keep hearing the same honk every
Yeah.
every 30
Same
seconds.
guy walking
like,
by
okay,
on
I'm
the
gonna
phone.
lose it.
Yeah,
So
yeah.
that's something to think about too.
And then, like, if I'm working on a task versus just focusing on the noise,
Yeah.
like I feel like that has two different effects. And then lastly, the Portland airport just announced that they were gonna do EDM days or hours or something. So there's a natural experiment for you.
Can't wait to see the results on that one.
Yeah.
That'll be so cool. That's awesome. Yeah. Thanks. I appreciate it.
How do you control the decibels that a computer's putting out? Do computers know how many decibels they're able to put out?
Hey, Ian.
Actually.
Yeah, I'm not sure.
Or if you have speakers attached, like how do you even?
Yeah.
Yeah, doing it in people's homes, all of those variables are free to vary, so a lab study would be better.
And that was kind of funny that they like acknowledged all of the previous studies looking at auditory effects like this all were in laboratory settings, but not ours. Ours was done online. So I thought that was kind of funny.
What is the mathematical function for the decay of noise from distance?
Inverse squared.
So the distance from the speakers then becomes a massive question, right? In terms of what the dose is administered to the person. Yeah, so very good question.
And I'm not sure, but I think I read in the article that they did have to have headphones. So I think or something like that. So I think they didn't have to rely on the distance of a speaker. It was more so. But if I'm wrong, then that would be something for sure to think about.
Headphones is another problem. You're now putting on things that are uncomfortable for some people. Besides the dose question, and it's also then becomes what is the applicability? Because then you're extrapolating right to the airport and all these other things where you're not wearing headphones.
Or you're listening to it at 2 PM in the middle of a busy workday or at 10 o'clock when you're trying to go to bed.
Yeah.
And, to harp on this point just a little bit more, how are they even verifying that they're using headphones and not speakers, right? And even if it's just a checkbox saying, yes, I'm using headphones, it's all self-report. And if you're doing this at, midnight after you got off another job to make another $15,
Yeah.
like, are you going to go rummage around to find your headphones? Maybe, maybe not.
Yeah. For sure.
And then I guess like another point on like the sample is like the MTurk and Prolific, like their whole point is to finish the survey, right? Their incentive is to do it as quickly as possible and get paid. So I'm skeptical because they didn't include that they excluded anyone for like how quickly they completed the survey.
Yeah.
Or if they included any like attention checks. So I'm just skeptical that the people actually did the survey instead of just like rapidly completing it and getting paid.
Yeah, but you also have to think that like maybe the researchers kind of look, the response bias of check. You can kind of pick that up because for us in Prolific for our RMPA study, we did have to go and clean the data and make sure that people weren't like, it didn't sound too AI or people weren't just saying stuff. But so I do think that is something to consider, but yeah, lots of thoughts about it.
But you need to tell your reader how you made those decisions. And that's an important thing.
So with this, there are lots of flaws. Do you think it was one valid data point to have?
What do I think is one valid?
No, do you think this constitutes a valid data point in the literature or in the research?
Yeah, I think so. I think there's definitely, like we talked about, there's a lot of points of critique and
Okay,
stuff.
and let's go with that. Let's say this was pretty inexpensive to do. I don't know if it was or wasn't. So if we did more and more of this, would we converge to the correct answer or would we diverge away? What's your thought?
I don't know. I think it would depend on the future research that we did. So if it was more longitudinal, getting better participants and stuff like that, I think we would kind of get more in the direction of good research and good data. But I think if we just stayed in how it was like this, just kind of throwing it up on Prolific just for 6 minutes, I think maybe we would kind of go into a different way where
Okay, thank you.
Okay, we're gonna have to move on. We are well past time, but thank you very much. Here we go.
Perfect.
Well, my name is Hunter Esplin. I'm a first year industrial hygiene student. And today I'm going to be talking about a study on exploratory noise exposures in educational and private dental clinics. Don't worry, I won't make you listen to those noise in the dental clinics. Because that would cause me anxiety for sure. So a little bit of background. So noise-induced hearing loss is one of the most common occupational exposure illnesses in the United States. There's a lot of data on traditionally high-risk industries. So construction, manufacturing, mining, we know the level of noise that causes hearing loss. And so we can point to industries that have really high noise and say that will cause hearing loss. But some of these other industries where there's been less research that maybe aren't as typically regarded as high noise, there hasn't been as much done. So this study was looking at dentists evaluating the loud equipment that might put them at risk of this noise-induced hearing loss. So why did I pick this article? Got a weird morbid curiosity of dentists. I don't get it. Maybe if I got paid as much as they did, I could put my hands on people's mouths. But can't. I just looked up the dentist online, and this image is one of the ones that popped up. It doesn't look comforting. He's got crazy eyes. I don't get it. And then I've also been doing a lot of sampling for bioaerosols at the U's dental school itself this last semester or so. So I've been exposed to it. And then I really enjoy looking at noise. One of my hobbies can have a nice sound level measuring app on your phone. So I like to measure the sound, the noise at different events. It's okay at sporting events. My wife doesn't appreciate it at her family functions, even if they are above the occupational limits, but it's neither here nor there. This article also encompasses a lot of the things I liked and disliked from the wide variety of different noise studies that they've done at dental clinics in general and some of the other smaller, less traditionally noise hazardous occupations. So they collected 79 different samples from 46 different subjects. They had 37 dental students that worked in endodontics, pediatric, preclinical, and prosthodontic dental clinics. And then they had 3 dentists and 6 dental hygienists that worked at private dental clinics in the nearby area. And they collected a mix of partial and full 8-hour dosimetry. So if you've never seen noise dosimetry before, I took an image and slapped it onto another image there. They hang the dosimeter near the person's ear. In this case, they put it on their non-dominant side. So if they're right-handed, they put it on their left side because previous studies had shown that dentists had more induced hearing loss on their non-dominant side from leaning in closer to where they were doing their tools. I thought it was interesting, and then they didn't talk about it at all throughout the rest of the study. So they used an ER200D dosimeter to collect 3.75 minute averages. And then they converted those results to an 8-hour average to compare it to occupational standards. One thing that was really weird about this study is the dosimeters and the way that they used them. It's weird that they collected 3.75 minute averages and then used that to average the whole exposure instead of just doing a continuous average like a lot of other dosimeters use. So I thought that was weird. A little bit more. And then they also used the more protective NIOSH criterion for noise exposure with the recommended exposure limit of 85 decibels and an exchange rate of 3 decibels. So simply put, if your average exposure is 85 decibels for 8 hours, you'd have 100% of your dose. If your exposure was 88 decibels for 8 hours, you'd have 200% of your dose. 2 decibels for 8 hours would be 50% of your dose. And I thought that was interesting as well. A lot of the other articles use the OSHA PEL, which has slightly different criteria. But the NIOSH one definitely would give you some better results, more larger numbers, and is a little more indicative of what actually causes hearing damage. So the results before we converted them to time-weighted averages, the hygienist had the highest average is 66.4 decibels, dentists 61.8, and students at 60.5. So all of those are well below any occupational limits. And all of their standard deviations were in pretty similar. Once they converted those results to 8-hour time-weighted averages using the equation I showed earlier, they started to see a lot more differences. The students had a 2 to 3 times greater standard deviation in the private clinic. And you can see the darker lines dashed in the sol, those are the hygienist and the dentist, as that they measured more than once. So that's their total. That's the measure of exposure over their several different sampling periods versus some of the students that are the lighter gray lines. And they're kind of all over the place. So even students that they measured multiple times had wildly different results. And that can be just because students do a lot of different work. And so they might be working the full time, actually doing stuff, or maybe on the next time they're still working in the same clinic, but the actual dentist is working with them and pausing as they're going through it, which could explain some of that. And this is where it gets a little more interesting. Once again, they took those average exposures and they turned them into time-weighted averages to compare them to the actual regulation standards. So by doing this, they assumed that any time that they didn't measure, so if they only measured for 3 hours, they assumed that the other 5 hours they weren't exposed to noise at all, which can really change how the results pan out. So they ended up splitting it into 2 different categories. Samples that lasted less than 4.5 hours and samples that lasted 4.5 or more. So the shorter term samples, their average was 3 hours and the longer one was 7.5 hours. And by doing that, they, once again, hygienists had the highest exposure rate in the dentists and the students, but it was a lot closer than it was previously. And then in the clinics, which I thought was really interesting, their pediatric clinic actually had the highest long-term exposure, as well as the highest singular level of exposure. And the preclinical had the highest short-term single exposure, and the private dentist group had the highest average exposure in that short-term group. I have a lot of thoughts about the way that they did this. I think it's weird. It's hard to compare 2 different groups. If you run some of the math on the numbers, if you assume that they were only exposed for those 3 hours, but they were really exposed to 8 hours, you can be reducing their actual exposure by 4 to 5 decibels, which can make a really large difference. You can kind of see that in the 2 different categories between the short term and the long term. Again, kind of interesting. So moving into that, their discussion, they found a slight risk of noise-induced hearing loss. Some of the samples, around 4%, would be around 3, were above the recommended exposure limit, and the rest seemed to be pretty low. Notably, the pediatric clinic had the highest average, highest maximum noise level, and the greatest variability in levels. And they attributed this to child-related noise, so kids screaming during their dental procedure. If you have children, maybe you can relate to that. Once again, this picture is just one I searched up dentist, and that's what they're showing. That kid's in pain. All right. So some of my thoughts, the strengths and weaknesses of this study. They use personal dosimetry, which is what you should be doing if you're trying to get individuals' actual exposure. It surprised me, the articles that I read, how many of them just use a standard sound level meter, took a couple of measurements over a short period of time, and then just guesstimated. So I really liked that they did that. I also thought it was interesting that they incorporated a wide variety of the clinical situations. So by doing that, they were able to say, hey, the pediatrics dental group, they did have a higher noise exposure than a lot of these other people. versus if they had just done it at a private dental clinic where they see a wide variety of different people. They probably wouldn't have identified specific groups or specific practices that might result in higher noise. Some of the weaknesses, they had a really small professional sample size, roughly 9 employees, 3 dentists and 6 hygienists, compared to 40-something students that they were able to pull from. And that made it really difficult to compare the two groups together, especially when they were trying to compare it by hygienist, student, and dentist, because they really had a wide, didn't have enough people to actually do that very well. Back to the dosimeters, their lack of continuous noise measurements made it really difficult to find peak exposures. So usually with a dosimeter, it takes a continuous reading and you can really see when the noise spikes and when it doesn't. So the fact that they just averaged out every 3 and a bit minutes really made it hard to see that. And they also had a statement about they weren't able to calibrate them. They calibrated them at the company. They sent them out. They used them for 6 weeks and they sent it back. And they said that they were within the specifications for calibration, which is also weird. I didn't understand. I read through the whole manual on the dosimeters because I thought it was just odd. They don't seem very great. So I was really confused why they would do this. And it turns out that they actually funded this study themselves, the dosimeter manufacturers. So that's interesting. They also took short sample durations. And then, like I said earlier, that might not actually accurately represent the exposure of the dentist. And it makes it really hard to apply it, generally speaking, to other groups, because we really don't know if it would be higher or if it would be lower. And then because this was a cross-sectional study, we can't actually determine causation. So we can't say being a dentist using these tools will give you hearing loss. We can only say you might be at risk. So if they wanted to do any more, they'd have to do some more actual hearing tests to actually determine whether or not dentistry is causing noise-induced hearing loss. That was it for my overall stuff. Any questions?
Quick comment. You mentioned in their time-weighted average calculation that they were assuming non-measured hours were 0, but I don't believe time-weighted averages function that way. I think they use the sample to extrapolate to a full workday. So you would just get your estimate of the full workday exposure would be better with the longer sample than the shorter sample, just like having a smaller sample of people is going to estimate your population sample, but probably better if you had a bigger sample of people.
Right.
So that the greater than 4.5 hour sample versus the less than 4.5 hour sample, we might just want to trust the longer samples more because they're sampling a larger proportion of the dentist's workday. And then I think while I have the mic, I'll just say the overall exposure levels are interesting, but having visited the dental school recently, I'd be really interested in the culprits. So what are the, like you were saying, the peak exposures, like which tool, the suction, the drill, the clean, what's generating the highest noise exposures, because that might give you what you could alter or control through engineering controls.
But of course, they couldn't figure that out because they're just sort of.
I mean, they're in 3.5 minute bins, so you might be able to pick 3 minutes that were really high, but yeah.
I thought it was really funny that the loudest noise was the children. I definitely think that makes sense. Do you feel like with the noise sampling, because they did a more rigorous, like you talked about having like the personal dosimeters, do you feel like that then limits their ability to single out the equipment because it's focusing on the dentist rather than like where the noise is emanating from? Because in theory, I mean, they could strap one to each piece of equipment, right? But that would potentially be a lot, I guess.
That's a great, I think that's where multiple different devices come into play. So going in with like a sound level meter and measuring as they do specific tasks and then applying that to their overall assumption results would really be able to give you that. Just looking at one or the other doesn't quite help.
I wanted to go back to the comment about how they treated unsampled time. So I think it's page 743 in this article, but under data analysis, then they say, note that this equation assumes that non-measured intervals during a subject's work day contributed nothing to the daily noise exposure. So I read that as they did treat it as zero, right?
I think so.
I don't know. I was just curious, like.
I know, so if we go back to like actual noise, you're conducting a study, there's two ways to do it. If you sample, like let's say they have a 10-hour day and you sample for 8 hours, they're working on the manufacturing floor, and the last 2 hours they're going and working at their desk. Typically what we'll do is we'll assume that they work for 10 hours, but we'll assign 0 to those last 2 hours because they're not doing anything. So in this case, I think they're saying because they only worked for 3 hours, those other 8 hours don't count. But that doesn't really apply to a dentist working a full time.
But the T in the formula is 128, which is the total number of samples you would expect in an 8-hour period. So that's how they're extrapolating to an 8-hour day from the measures they collected, right? Their phrasing's a little odd, but, and I don't use these equations regularly, but it is a confusing sentence about, I mean, you have no information for the unmeasured time, so it can't influence your results. But assuming it's 0 is really different than extrapolating your sample to the whole day.
And like in this case, so they took their average, right? And then they used that equation where they just put in how many samples that they actually took and then divided it by the number in the 8-hour day, like you said. And it does make a pretty big difference when you having 5 hours of sample time.